So we're going to start with a layer of fixamol. So our fixamol is going to go from the tibial tuberosity up to the lateral epicondyle and the medial epicondyle. And then we can apply our other fixamol now for the medial glide, just so we've got it there for later. So that's going to go again from medial to lateral epicondyle. Now, what I would also do is ask the patient to have their phone with them and actually film you doing this so that they can go home and replicate it themselves. It's also important that you've got their knee in a little bit of flexion. If you put the tape on, particularly the medial glide, and their knee is an extension, they won't be able to bend their knee when they get up again. All right, so we're going to apply our fixamol from the tibial tuberosity up to the lateral epicondyle, and with our fixamol, we're just laying it onto the skin. We're not putting any tension through it. Like so. Ideally, you don't want any wrinkles in this because the wrinkles can irritate the skin if it's left on for a couple of days. And then with our medial glide component, we're going to find the top and the bottom of the patella. We're going to basically center our fixamol over that and run from one epicondyle to the other. Okay. So then, when it comes to applying the rigid tape over the top, with our fat pad, one of the most important components is actually getting that lift when you apply your tape. And so you want to anchor the rigid tape really well to the tibial tuberosity. You're going to put the fingers of your other hand underneath and really lift up that fat pad and soft tissue up in a direction that is perpendicular to that line of fixamol. You're going to pull the tape tight, stick it down, so attach it really well, and then let go of that hand. And that gives you a really nice sustained lift, which you can see with all of those wrinkles that are present in the fixamol there. So we're then going to do the same thing on the lateral side, so really lifting up, pulling the tape tight, sticking it down, and then letting go of your fingers. And I would do 2 layers of rigid tape on each side just to make sure you've got a really nice hold there. Okay, so this is the point where we would stop. We would get Josh to get up and go through that aggravating activity again. If he reports feeling at least a 75% improvement in his pain, then we might stop there. If he's still not quite getting enough improvement in his pain, then we can go to the medial glide tape.